What are meglitinide drugs? Most people may not be familiar with meglitinide drugs, so to give you an idea, these medications are similar to sulfonylureas. These drugs are a class of oral medications, specifically short-acting insulin secretagogues, used to treat type 2 diabetes. Meglitinide drugs work by stimulating the pancreas to produce insulin. These medications include two common drugs, Prandin or repaglinide, Starlix or natoglidide, but also Pragnamet, repaglinide, metformin is also being offered in the market. Meglitinide are similar to sulfonylureas, but they have a shorter duration of action. It is usually taken to lower blood sugar levels after meals, helping to minimize the A1C, also known as HbA1c levels. Although it has a shorter response to the body, it is as effective as a sulfonylureas in lowering A1C levels. In fact, according to a study, meglitinide can reduce A1C levels by about 0.4% to 0.9%, while sulfonylureas can reduce A1C levels by 1%. You may use meglitinide as monotherapy or as a combination therapy with other diabetes medication. It may be taken before each meal, but one of meglitinide's side effects is hypoglycemia that usually happens if regular meals are not eaten before taking it. Meglitinide side effects. Meglitinide side effects are just mild and tolerable to some people with diabetes, but others may experience severe side effects depending on the health history and how and when they take the medication. Common and adverse side effects. One of its common but might be adverse side effects also is hypoglycemia. It is where you experience a significant drop in your blood sugar. Since meglitinide drugs are intended to lower blood sugar supply in your body, they can cause hypoglycemia if taken regularly before meals. A person experiencing hypoglycemia may have symptoms of sweating, lightheadedness, shakiness, and confusion. Also, with repaglinide, the occurrences of hypoglycemia are quite similar to that of sulfonylureas, but the incidence of serious hypoglycemia is lower. Although others experience adverse hypoglycemia, some people who regularly take a meal and don't drink more alcohol are less likely to experience a severe drop in blood sugar. Cardiovascular mortality is also one of the common meglitinide side effects. According to a study in Europe, repaglinide is restricted to some patients with severe liver conditions and is not recommended to elderly over 75 years of age. Other meglitinide side effects: respiratory tract infections, headache, diarrhea, stomach ache, dizziness, fever symptoms, cold symptoms, weight gain. Meglitinide examples. Meglitinide medications require a prescription from a doctor. The U.S. Food and Drug Administration has approved meglitinide drugs for type 2 diabetes since 1997. The medication includes two common drugs, repaglinide, which is the first type approved in 1997, and natoglidide, a second one approved in 2000. But Prandin, repaglinide, metformin is also being offered in the market. The Starlix, or natoglidine, is an oral medication taken to treat type 2 diabetes. Natoglidine is usually used alone or in combination with other diabetes medication. It works by helping your body regulate the right amount of glucose in your blood. It minimizes the amount of sugar by stimulating your pancreas to release insulin. The Starlix medication comes as a tablet taken orally. You should monitor your blood sugar closely and carefully follow what was stated in your prescription. Take the medication exactly as stated. Your doctor may gradually increase your dose depending on your body's response to it. Starlix side effects may include seizure, hives, difficulty breathing, swelling of your face, lips, tongue, or throat, jaundice, yellowing of the skin, headache, nasal congestion, joint aches, constipation, flu-like symptoms. Prandin, repaglinide. Prandin repaglinide is an oral blood sugar lowering drug of the meglitinide class used for diabetes 2 non-insulin dependent medication. It is usually taken each meal and used alone or combined with other diabetes medicines. Together with proper diet and exercise, it can cure diabetes, but this drug can cause hypoglycemia, particularly if you are taking other diabetes meds. Prandin mechanisms of action is to cut down the blood glucose levels in your body by stimulating the secretion of insulin from the pancreatic beta cells. Insulin production is glucose dependent and usually diminishes at low glucose concentrations. Some of the side effects of Prandin may include nausea, vomiting, hives, fever, confusion, weakness, difficulty breathing, swelling of face, lips, tongue, or throat, severe pain in upper stomach, fast heart rate, pale or yellow skin, dark-colored urine, burning in your eyes, skin pain, or bruises. If symptoms persist, call your doctor immediately for medical advice. Prandin, repaglinide, metformin. Prandin is a combination of two oral anti-hypoglycemic diabetes medications. This combination helps control blood sugar levels by producing insulin from the pancreas. It can improve blood sugar levels in adults with type 2 diabetes if taken together with proper diet and exercise. Some side effects of Pradamet are as follows: severe hypoglycemia, lactic acidosis, low blood sugar, face swelling, difficulty breathing, headache, nausea, vomiting, and diarrhea. If you experience some of these side effects, contact your doctor immediately to get emergency medical help. Conclusion: there are many remedy options for people with type 2 diabetes. Aside from having a proper diet and exercise, there are some oral and injectable medications that can help control the sugar levels in your blood. One of the common types is the Meglitinides drugs, available in 2 variants, Meglitinides and Meglitinides. If you require Meglitinides medication, feel free to visit ziprx.ca. We offer all the said medications at an affordable price. ZipRx, medications for less.